Enjoy your session, guys, and I'll hand you over to Chris.
Thanks very much for the introduction, Stevie, and thanks for inviting us along to speak. We thought today we'd do a little bit of an overview of how really to use your time best in the Tier 3 service to prepare yourself for bariatric surgery. So who better than Nikola to lead the session? She's going to talk a little bit about what goes on in the Tier 3 service in run up to bariatric surgery and why that's so important. And then we'll pick up on afterwards, why these things are essential for success after surgery. And then we'll just have a bit of a kind of question and answer session at the end. So yeah, I'll hand over to Nikola. Thank you.
Thank you very much, Chris and Stevie. So I'll say a quick hello now to everybody here. I'll just reintroduce myself again for those that have just joined now. So my name is Nikola and I'm one of the dietetic associate practitioners with More Life. So I am client facing in my role. A few of you may already know me. You may be my group clients, my individual clients as well. So I will say hello to you guys as well. But what our focus is going to be in today's session is really that preparing for surgery itself. So if you bear with me whilst I hopefully share my screen across to you all, and we will start the presentation. Here we go. So I'm hoping now that everybody can see the presentation that I've brought with me today. So absolutely the focus that we're going to be dealing with today is preparing for bariatric surgery, and I'm going to cover these areas here. And before I hand back over to Chris, the specialist bariatric dietitian, for the latter half of the session as well. So what I'm going to be running through with you all is really discussing through the transition from a Tier 3 specialist weight management service to a Tier 4 provider like Salford Royal Foundation Trust Bariatrics. I'm then going to be discussing how to prepare for bariatric surgery, particularly from a dietary stance, but I'm also going to be running through the Greater Manchester Stop Smoking support as well. And then I will be sharing you some further resources by NHS Better Health, just for further support whilst you await further contact from the Tier 4 provider as well. So first of all, I am conscious that we often talk about the different tiers and often we don't really explain those thoroughly. So what I'm just going to run through first is actually the different tiered systems surrounding weight management itself. So just to briefly recap over these, Tier 1 covers universal services, so such as health promotion and also primary care as well. Tier 2 covers lifestyle interventions, and Tier 3 covers specialist weight management services. So More Life, we are a specialist weight management service. We are led by a MDT clinician panel, and of course we can refer directly on to a Tier 4 bariatric provider. Tier 4 covers the bariatric surgery. So of course, Salford Royal Foundation Trust Bariatrics in this case. And what they offer is, of course, they offer the pre-surgery support, the surgery itself, but also really, really importantly, is that follow-up care post-surgery as well. So the first area of focus that I will be discussing through is actually a transition from a Tier 3 service, of course, to the Tier 4 end provider. Now, I will have to apologise, but obviously I am from More Life, so I know our service in and out in our transition. But for those of you that aren't with More Life and you're with another Tier 3 provider, they will all have a similar transition, a similar pathway in place. So for More Life, we do have bariatric criteria in place. And it's these ones noted on my screen now. So a -5% weight loss, at least 80% attendance on a Tier 3 weight management service, attendance to at least 2 Salford Royal Bariatric information sessions, so these sessions that we're on tonight, but also appropriate dietary and lifestyle changes as well. So once clients have met the bariatric criteria with More Life, they will then have a bariatric review within our service. And what this bariatric review aims to do is really to assess knowledge, to check criteria markers, but also to see suitability for bariatric surgery. Following this, your case will then be discussed within one of our in-house MDT meetings. So MDT is multidisciplinary team meeting. And on this team, we have a consultant endocrinologist, we have a lead dietitian, we also have a psychological lead. And it's following this MDT discussion that you will have an outcome as to whether we can refer you on to the Tier 4 provider, of course, Salford Royal in this case. So clients that are successful, the Tier 3 provider, or More Life, of course, for me, we will process your bariatric referral to the Tier 4 provider, of course, Salford Royal in this case. And it's at that point that we will also inform your GP and also ask them to organise a local sleep study for you. So the reason that I've included this is I do get a lot of questions coming back to me, sort of asking why this has been requested and why have I been referred on to a sleep study? I thought I was going to bariatrics. And I really wanted to just clarify that this is a routine thing that we ask GPs to do for all clients accessing bariatrics. And what this is for is it's to check for sleep disorders and particularly obstructive sleep apnea. So it's really important that the anaesthetist knows of this, of course, because they will be in charge of monitoring your airways for the bariatric surgery itself. But also conditions like this, it's really important that they are spotted and diagnosed appropriately to improve overall quality of life as well. So please don't worry about that. But if you have been referred, you will see that request on your GP letter as well. Now, it is after this point, and once you have come to the end of your More Life programme, your 12-month intervention with us, that you will then be discharged from our Tier 3 service. But really the key thing here is that the journey does not stop here. And we really do encourage continued monitoring and moving away from the service, of course, whilst you await that further communication from the Tier 4 provider as well. So what we know about this is that actually making sustainable changes prior to surgery will lead to the best outcomes post-surgery. Whereas if we are leaving it until after surgery to make these changes, it will be much harder, but also could increase chances of adverse complications post-surgery as well. So things that we do encourage you to have a think about is really thinking about how you might continue self-monitoring away from our service, also considering tracking progress and how you might do that moving forwards as well. And what we also do find is that actually continuing to set those SMART goals moving forwards can be really, really helpful as well. So it is a really great time to maybe consider the support network that you have. It may be that actually you think it would be beneficial to stay in contact with your other group members that were with you for the Tier 3 service at More Life or wherever. It may be that you want to focus on your closer, more immediate network, maybe family and friends, and again, leaning on them for further support as well. But also I have had clients that have gone on to join other support groups following on from our programme, particularly activity groups can be quite popular, walking groups and the like there. Now, one thing that I did really want to clarify as well is that we do really understand that it is particularly difficult at the moment, given the weights that we do have for bariatric surgery. So one thing that we are doing at More Life is we are running a drop-in session for all of our clients that have been referred to Salford Royal, the Tier 4 provider, just as an additional form of support, of course, whilst you await further contact from the Tier 4 provider. So I would say to any of our clients that are on this session today, if you would see benefit from accessing this drop-in session, then do reach out to our client services team, and they can then send on those Zoom links to allow you to access that drop-in session. And at the moment, at present, these are taking place on the first Monday of every month, starting at 12:30. And I would encourage those from other providers, other Tier 3 specialist weight management providers, to see what other support may be available within your services as well. So moving on, the next thing that I did want to discuss is really thinking about some of the dietary factors and preparation that we can do prior to bariatric surgery. And it really is about maintaining healthy dietary habits that we have put in place from the Tier 3 service and beyond. So actually getting into the habit of eating regularly. We always say it, that pattern of those 3 regular meals over the course of a day. Because what we know about that is it can really lessen things like grazing over the course of the day as well. We do encourage, again, to focus on things like mindfulness and portion control, tips and tools that you will have picked up throughout your journey with More Life and the other services as well. But also continuing to moderate sugar and fat intake. So some of you may be aware that one of the symptoms that can happen if too much sugar or fat is had after surgery is dumping syndrome. So again, really important to get into these healthy habits, of course, sooner, and be that best prepared for the surgery itself. Another thing that we do suggest is protein is of particular value after bariatric surgery, and it will be the main target for each of your meals. So actually getting into the habit of eating that component of the meal first, followed on by your vegetables, your salads, and of course your carbohydrates last, and really getting into that habit of doing so, again, can be really helpful for post-surgery as well, and particularly being able to identify what are your protein sources there as well. Particularly next we'll move on to talking about hydration, and I know we talk about it all through the More Life programme. I'm sure the other providers do as well, but drinking 1.5 litres a day, but actually learning to sip this throughout the course of the day. So one thing that you wouldn't be able to do post-surgery is down a big pint of water. It would be far too much fluid all in one go, and it could sort of regurgitate back up. So actually having a water bottle handy that you might carry around with you, and having a small glass of water at your desk as well, to really encourage these healthy habits prior to surgery as well. Other things that we do discuss, and again, if these are raised within the bariatric review, these would be discussed with you as well, but stopping fizzy drinks. So you cannot have fizzy drinks post-surgery, and I know these are quite popular. I know quite a few clients that are fans of the Diet Coke, the Pepsi Max, the Coke Zero varieties, but because these drinks are carbonated, they do of course contain bubbles of gas, which can actually stretch the bariatric surgery. So it's not recommended to consume these after surgery. So again, if that's a particular preference for you, then starting to consider at this point maybe what you might be able to change that to, or how you might lessen that intake as you run up to bariatric surgery as well. And similar with the alcohol consumption, so we don't recommend alcohol after surgery, and it is absorbed differently as well. So again, if that is a particular thing for you, then it's addressing and putting things into place sooner rather than later, really getting prepared for post-surgery. And the final two things that I'm going to mention in this slide, one of these you may have heard of, but you may have not. But these are things that we can do to prepare for after surgery itself. So the first one that I'm going to discuss today is the rule of 20. So a few of you may have already come across this, but what we mean by the rule of 20 is really nothing in your mouth that's bigger than a 20p piece coin. And then what we want to do with these smaller pieces of food, we want to chew those for 20 times. After we've chewed for 20 times, we're going to put our knife and fork down for 20 seconds, and then we're going to stop eating after 20 minutes. So really a great technique that will be used and implemented after surgery. So again, trying this out sooner rather than later, and again really getting in to the habit of doing that. A great thing about that technique as well is it really does slow down eating also. And then the last one that I'm going to mention on this slide is separating eating and drinking. So of course, after bariatric surgery, the stomach is much smaller, so it's not advised that you do both of these at the same time. So actually, not having a drink 15 minutes before a meal and making sure that it's after 45 minutes when you have one after, and getting into that habit can also be really helpful as well. So the next slide that I'm going to move on to is actually discussing smoking cessation and the importance of being smoke-free prior to bariatric surgery as well. So we do encourage you to be smoke-free before bariatric surgery, and the reasons for this I'm going to state below now, but it really is the fact that smokers do need more anaesthesia for all types of surgery. So of course, the risk of anaesthesia related complications does become higher. There is also an increased risk of post-operative infections and pulmonary and cardiac complications for smokers, a need for increased drug doses, but also increased experience of post-operative pain and increased risk of malnutrition. And I've got two little statements here that I'm going to run through. One's from the bariatric specialist nurse at Salford, and the other from the consultant endocrinologist at Salford, that really put this into perspective, the importance of being smoke-free prior to surgery. So the first one I'm going to read is from the bariatric specialist nurse, and it says, we ask that clients be smoke-free from 6 weeks prior to surgery, and then lifelong. So you can vape and wean down to 0% nicotine, therefore best to address this as early as possible, and of course really important not to restart after surgery as well. And then I'm just going to read the point from the consultant endocrinologist here. Almost every ulceration or stricture that she has seen in patients at any time post-operatively, and all gastrointestinal bleeds have been in people who smoke or take nicotine after surgery. So again, hopefully really highlighting the importance that if this is a particular area for you, then again to look at addressing it sooner as opposed to later on in the journey. So I hope that falls quite nicely into this next slide. And I am going to briefly run through the Greater Manchester Stop Smoking support as well. So all of this can be accessed through this Make Smoking History website. I have linked it at the bottom there, just on that pink border below. So makesmokinghistory.co.uk. And this offers all different resources for your locality as well. So there is a helpline. So it's a Greater Manchester Stop Smoking helpline, and this is available weekdays and also weekends and bank holidays at a slightly reduced time frame, and these calls are free, and that's with that 0300 number there. On this website, you can also gain access to the smoke-free app, the one that I've got on the right-hand side of my screen now. So what you get access to here is you get 6 months free use of this application, which does provide 24/7 support. You're able to monitor your health improvements and also track how much money you might be saving as well. So a really nice application that you can gain access to. And for those of you that might be wanting to find more specific support, of course, within your set locality, again, all through this website, so this is a Make Smoking History website, you can also select via your location. So you can select the borough which you are in. It might be Bury, it might be Rochdale, it might be Manchester Tameside, and that will take you through to your local stop smoking support. And most of these are self-referral services as well. So do utilise that website if you think it might be useful to you. Now, finally, and just to end, sort of draw my presentation to a close, I am going to briefly run through a few extra resources that could be helpful for you all as well. And this is through the NHS Better Health. So what we have through this is we have access to a wide range of different information, different resources, particularly focusing on weight management, smoking cessation, physical activity, lowering alcohol consumption, but also wider well-being and mental health as well. So what I'm going to talk you through is just a few of the resources and external things that can be accessed. And of course, all of these are freely available. So whichever weight management service you are in, you can all access these at your leisure as well. But if you click on to their weight management support, you will find a wide array of additional resources, but also they do recommend the app that I have put on the screen here. So this is the NHS weight loss plan, and what it is it gives you access to a plan that's about 12 weeks in length, and it's an app that allows you to set weight loss goals, to plan your meals, make healthier food choices, but also you can record your activity and really track your progress on here as well. So really, really great for that monitoring side of things. The next one that I'm going to go through is the NHS Quit Smoking resources. So exactly the same, if you click onto their Quit Smoking designated page, there is a wealth of extra resources that can be found there, and also the links to the NHS Quit Smoking app. So it's quite similar to the smoke-free app. It does allow you to track progress, again, monitor savings, but also get that really important daily support as well there. The next one is their Get Active page. So particularly for extra physical activity tools, tips and advice, this one. Again, a wealth of further resources can be accessed here, but also there are these two applications as well. And some of you may have already come across these. I know Couch to 5K gets some really, really good feedback from that one. But Couch to 5K, it is a running program for absolute beginners. And it really works your way up to either walking or, of course, running that 5K mark. A really nice thing about this app is it can connect you to other Couch to 5K runners as well. So again, if you want to broaden out that support network, it could be a really, really helpful tool. The next one here, and this is probably slightly lesser known maybe than the Couch to 5K app, is the Active 10 application. So really, really great to record and track steps. I know many people tend to have sort of a step goal in mind as well. So it does also help you set those goals, but also shows you your achievements. It's really, really important that we do celebrate the achievements that we do have, but it does also give you extra tips in terms of boosting activity levels as well. Now, the final application I'm going to show you, I promise, I know we've been quite app heavy with my run through today, is actually some further support surrounding lessening alcohol consumption. So again, we're on the Better Health page, and if you click on their drink less, you will get their further resources surrounding this area. And there is an app that they do recommend, and it's this one here called Drink Free Days. So what this does, lots of practical advice in terms of lessening alcohol intake, tips in terms of getting in more alcohol-free days, but also you can set reminders. And again, really, really important that we're really celebrating those key milestones when we do have them as well. So I will be ending my run through on this final slide here. And of course, it's really important that when we think about overall health, a really big part of that is, of course, our well-being and our wider mental health as well. So there is, on the Better Health pages, there is this Every Mind Matters, which has a wealth of extra resources aimed at helping you to look after your own mental health. And of course, there are things that we can all do to really look at improving that as well. So what this offers is actually expert advice alongside practical tips in terms of how we can look after our mental health and well-being better. And of course, really important of actually finding what works best for us as well. So I have just attached the link to this website at the base of my page here. So to access all of those resources that I have just ran through with you all, it's www.nhs.uk/better health. So hopefully that was informative. I will be handing back over to Chris now just to finish our presentation today, but thank you everybody for listening, and I look forward to your questions as well.
Thank you, Nikola. That was excellent. Thank you for that overview. The overview of the tiered service and the importance of kind of ongoing self-monitoring, and the importance of the dietary changes that are going to be vital after surgery. Stevie, would you like me to run through some of the questions?
Yeah, we're going straight into the Q&A.
We can do, and then I'll carry on, so that it might help me with the next bit.
Yeah, no problem. So one of the first questions that popped up was, what is dumping syndrome?
So dumping syndrome is where syndrome is a variety of symptoms. So you can have one of these symptoms or all of them, or a combination. So it's getting lightheaded, sweaty, dizzy, shaky. You can end up with vomiting, and you can end up with diarrhea. So it's a mixture of them, or one of them, after basically a very rich meal. So either anything that's too sugary or that's too fatty, it gets into your digestive system too quickly, and then you end up with those symptoms. And that's why it's important that you stick to low fat, low sugar foods, and you follow the eating habits as well that Nikola went through with the rule of 20. If you eat too quickly and you don't chew enough, then you can get dumping syndrome as well. So eating habits, it's not just about what you eat, but how you eat it as well. and avoiding anything that's too sugary. And that will give you good, hopefully give you a clear steer of dumping tomorrow.
Thanks, Chris. So Kieran has asked, why is it important to eat your carbohydrates last?
Because we want you to go for the most nutritious dense foods. So the foods that are high in protein are foods that are high in fiber. So your your meats and fish and things like that for your protein, and lentils and pulses, etc. And then vegetables for the fiber and the vitamins. And that's why those two are the most important. Carbohydrates, yes, you will get some micronutrients and fiber from, but you're going to get a lot of energy from there as well. So they're the bits that we want you to keep to the smallest part, because you're going to be using your body's energy stores for energy.
Thanks. Nikola and Anina, you might want to come back in for this part. But somebody else has asked, following on from one of the slides you went through there, Nikola, could you speak to weight gain and quitting smoking? So how should somebody manage that if their overall aim is to lose weight in order to get bariatric surgery, but we're suggesting, or we need them to quit smoking? How do they manage that weight gain during that time?
Me to take it.
Yeah, do you want to take that?
Yeah, so it is difficult, and we would encourage you. Obviously, a lot of people lose the weight first and then look at the quit smoking. And so it's important to keep with the habits that you have done to lose that initial weight, and then obviously get support for the quit smoking as well. It is difficult to do alone, and there are great free services in Manchester that will help. And it's finding a habit to replace the smoking that isn't then eating. So focusing on a positive habit that isn't just going to be replaced with the eating, because that's often what people do. Might be doing something with your hands, doing something with your mouth, obviously the increased appetite. But it's referring to what we learn in the program, finding distraction techniques, mindfulness, things that you enjoy as well. But always ask for support as well from the quit smoking services.
Excellent. And I think that's a really important part, not just for smoking, but for comfort eating as well.
Yeah.
If you're somebody that eats for comfort, for pleasure, or when you're stressed, or you rely on it as a bit of a crutch, then using those tools that you're learning to stop doing that will help you after surgery. To get the weight off, keep it off, because things can slip back. You can slip back into old habits. So yeah, just like smoking, comfort eating, get that addressed as well.
So this next question's around vitamins and mineral supplements. So I think Thomas has asked, how important is it that we actually take these? Is it very important, or is it like our 5 a day? Everyone should do it, but most people don't.
Well, we know that the majority of people in the UK, feedback in the UK, are going to be deficient in vitamin D. Because we don't get much sunlight, so that's one that's important for pretty much everybody. And we know that in the fullness of time after bariatric surgery, people become deficient in vitamin B12 because you don't absorb it the same, and iron as well, because when you don't absorb it the same, but you don't actually eat as much of it either. So we know in the fullness of time those things you might become deficient in those. So it's a recommendation that you take the micronutrient supplements regularly to prevent deficiencies. It's not that you're deficient in them now, but it's to prevent them in the long term. It's either that, or you have more regular blood tests, and if your levels start to fall, then you pick them up again. But in our view, it's better to prevent deficiency than to treat a deficiency.
So the next question's around the liver reduction diet. So people are just asking kind of what does that entail? How long is it? What should they expect during that period?
So I've got that on my little bit next, so we'll go through that when I'm actually. Is that Steve frozen, or is that me?
I think I'm back now.
Yep.
Yeah, sorry about that. So the next question is around IBS. Somebody's asked, are they likely to be more symptomatic post-surgery?
We won't know until you've had the surgery, unfortunately. There's no way of telling whether it will get better or worse. So in some people it does get better, in other cases it changes its manifestation. So maybe from having diarrhea all the time to maybe a bit more constipated. So it does change afterwards. There's no real way of knowing, unfortunately.
Thank you. Nicola, this one's probably for you. You've mentioned the bariatric review criteria for surgery, but what would prevent somebody from being given the okay at that MDT?
There we go, remember to unmute yourself. More so it would be if they've not made the dietary adjustments necessary for success post-surgery, or if there were other psychological factors, particularly eating disorders, things like that coming into play, which would need to be treated first.
And is it always either a yes or a no? Is there any in between at the MDT process?
Yeah, that's a really good question. So we do have 3 different outcomes following the MDT. So it could be a yes, and of course that's when all of those criteria markers have been met and your suitability for bariatric surgery has been seen. Usually it's a no when there are key markers that haven't been met, or of course concerns in maybe a few of those other areas mentioned. But there is the potential for another option, which we call an extension period. So what that is we would extend your time on our Tier 3 specialist weight management programme for a set period whilst you work at achieving a set goal that has been outlined from that bariatric MDT.
Perfect, thank you for that. And then for anybody that's with ABL, that's exactly the same process, which I'm sure some of you will have already encountered. So we've got some more questions around drinks actually, so I'll give you both of these at the same time and then any of you can take them. So the first one is drinking no added sugar cordial okay, recommended? And the second is somebody drinks sparkling water but it's not very heavily carbonated, could they still drink that, or did they need to move away from it?
So I would support anybody after bariatric surgery to avoid fizzy drinks. You're just not going to be able to drink the volume that you do now. So if you think about after the operation, when your stomach is, a third or less of the size of it is now, and you're going to try and drink, I mean, this is a litre bottle, you're going to need to drink, 2.5 of these a day. And if you're trying to fit that in with, it's fizzy fluid, you're just not going to be able to manage. You're going to feel uncomfortable, you're going to be belching all the time. And yes, it will contain those bubbles that can lead to problems further down the line. And if it's quite acidic as well, it can lead to ulcers and things. So I would encourage everybody to try and avoid fizzy drinks. You can have them as a bit of a treat every now and again. It's not going to do you an instant, it's not going to damage you instantly. So you can have them as a treat. So for example, a glass of champagne on your birthday, you can have the alcohol and a bit of fizz at the same time. But as an occasional treat. In terms of no added sugar squash, I'm happy with any kind of low calorie fluid that's going to get you your hydration. So if you don't like water, or you go off water after surgery, because that can happen, taste changes happen, then a little bit of squash I'm happy with. I'm not sure about you guys.
Anybody else want to add anything there, Anina?
No, I would completely agree. So as long as it's sugar-free and uncarbonated, then that would be absolutely fine to have. And obviously they're easier swaps before. It's hard going from, drinking Coca-Cola full sugar to going to water. So you can kind of do a step down approach, maybe going for fizzy water with no added sugar squash, and then going to the plain water with the no added squash, just to make it a little bit easier.
Thank you. So a question about the rule of 20. So is this for life, or is this just something that we should use as a tool after surgery while we let the stomach heal?
You'll find that as you go on from surgery, you'll get to know what you can and can't tolerate and how you should eat it. So things like red meats and white meats are all going to be quite difficult. So you're probably going to have to do that rule of 20 forevermore with those types of foods, and otherwise you're going to end up being sick. There are some foods that maybe you don't need to chew that as much, but I'd still encourage you to take your time with your food. You've still got a very small stomach pouch, so no matter how much you kind of chew. If you eat too quickly, it's going to be too full. You're going to end up being sick. So yeah, these are habits to get into for the rest of your life. And if you don't follow them for the rest of your life, you might come into problems down the line. And the majority of people that I come across that are having problems have forgotten their eating habits. They've got into old ways, and they've got a bit lapsed. So they might be eating and drinking at the same time, or they're just simply not chewing enough, or they're being distracted when they're eating. They're watching TV, or they're talking with friends and then end up vomiting afterwards. And that's all because of poor eating habits. So although the eating habits might be able to relax a little bit, if you do, you might think of pay the price and face some consequences.
Thanks, Chris. And I think this next question's, something that's probably high on everyone's agenda at the minute. So, has anybody got any useful tips on eating healthily on an extremely small budget?
Absolutely. I mean, I think one of the biggest things that's overlooked is the use of the frozen aisle, frozen vegetables, frozen fruits, and tinned as well. A lot of people overlook those choices because they think fresh is better, when actually going for the frozen option is even better sometimes, and especially after surgery, when your portion size is going to be so small, buying vegetables fresh and fruit fresh might just not make sense economically, because you're going to be wasting a lot of it. You're not going to be able to eat that volume. So having the frozen and the tinned options are always a good one. Any other tips?
Yeah, I was going to say another thing to add to that is particularly planning of meals can be a really handy tip as well. Things like batch cooking, making in bulk and freezing, so that you can make all in one go. You can use up the bits that you have got, and then of course hopefully you're going to lessen any waste as well there. But I really do encourage things like planning meals, and again it can be really helpful post bariatric surgery that as well, to get into that habit of doing so.
I was just going to add, I think it's something on everyone's agenda with the increased, cost of living. And I think about where you're shopping as well, because some supermarkets do have cheaper products than others. So maybe shopping around and seeing where you get the better deals, and also thinking about where you've maybe made cuts to save money, whether it's takeaways or eating out or cutting back on alcohol, because actually you might find that in some ways you have saved money that can then be factored into your weekly budget as well. So it's always good to maybe put it on a spreadsheet and see where your money is going, and what savings you have made and how much you can spend each week. To planning as well.
Imagine you run a very tight ship, Anina, at your house. I would always suggest batch cooking. I think that's something that's quite helpful if we're trying to save money. We can help ourselves by avoiding takeaways, those kind of on-the-go quick grabs that we might go for if we're prepared. So much like Nikola said, planning in advance what you might make. If you've batch cooked something, you've always got something ready that is healthy and you know exactly what's in it. So that would be my top tip, I suppose, at this point. So Chris, would you be happy to move on to your presentation now, and then we'll ask some more questions at the end?
Yeah, absolutely. Just to go back to kind of setting realistic expectations, that there's average weight loss for all these procedures. So 70-75% for a bypass, 65 to 70% for a sleeve, and they're at kind of 1 to 2 years. So just make sure that you're setting your expectations realistically, really. Everybody's got their own journey, so don't be comparing yourself to other people. Just think about your own journey and your own excess weight loss. We're going to be there to help you and give you some support for that, but make sure that you're setting your own expectations. Be prepared for a few plateaus, or weight loss plateaus. So weight loss, when it's going well, will kind of drop and then plateau and drop and plateau. And the further you get away from surgery, the longer the plateaus become, and that's absolutely normal. So be prepared to have a little bit of a weight plateau. So don't be afraid of those things. And be beware as well that weight regain is a real possibility. All those things that Nikola was telling you before about the eating habits and the rule of 20 and the planning ahead and making sure that you're focusing on the proteins, etc. They're all to make sure that the operation is safe and you're losing weight in a healthy way, but it's also to prevent weight regain. So we do tell you these, we advise you to do these things to promote long-term health.
Somebody's just asked, if I have been on a waiting list to join More Life for a little while, and I've lost a stone, will that weight loss go towards my 5% weight loss, or will it be the weight when they arrive at More Life?
So we do try and give the client the best chance really of achieving that 5% weight loss. So if they have lost weight on the waiting list, we're not going to penalise you for it. We would still take that into consideration and put that towards the 5%. So well done if you've lost weight whilst on the waiting list. That's really good.
So yeah, going on to my slides, let me just get these up. And hopefully you can see that.
Yeah.
Yeah, great. So just to let you know that this is what the support group used to look like. So we're all on cameras, sat at home, nice and comfortable. This was what it used to look like pre-pandemic, where there's lots of happy, smiling faces, and you could get together and share stories and talk about progress and what have you. Hopefully we'll get back to that at some point. But for now, I think this form's really good, and obviously run by Choose to Change, which is great. So the liver reduction diet. So we've talked about some dietary changes previously, and obviously the liver reduction diet is really, really important part of the preparation for surgery to make the operation as safe as possible. So as you can see there, the liver is this large red organ that sits in front of your stomach that's just behind, and that's where they're doing the majority of the work up here. So if your liver's quite big, it can get in the way, and they have to move it out of the way with a retractor. And if they do that, you can run into problems with it bleeding and all sorts. So you need the liver to be nice and small and supple. So we put you on this liver reduction diet, and it's for at least 2 weeks. So it's very low energy and low carbohydrate to shrink the size of the liver. Good. Done that bit. So yeah, again, you can see the size of the liver there that's right in front of the stomach. We want you to be following this for 2 weeks before and not afterwards. Please don't follow this afterwards, very important. And if you do have diabetes that's treated with insulin, or you have any kidney problems, you need to have a one-to-one with me before you start this to make sure that, that you're doing it safely. And this is what our version of the liver reduction looks like. So you're allowed 1 portion of carbohydrate 3 times per day. You're allowed 2 portions of protein, 2 of dairy and 2 of fruit, and then unlimited non-starchy vegetables and salad. And we give you a booklet with the portion sizes in, so you can take that home, you can read them, and you can plan your day. But there's an example on the screen there that you can have a look at. So very small portions of carbohydrate, very small portions of protein, but then you can really fill yourself up with those unlimited non-starchy vegetables and salad. Now, I would recommend anybody that's in a tier 3 program to give this a go for a few days just to see what it's like, get yourself used to it and the hunger that you're going to feel, because it is quite restrictive. So it's a hard diet to stick to, but it's an easy one to follow. So if you practice it, you'll do better. And a lot of people will lose quite a bit of weight on this, maybe a stone and a half in those 2 weeks that you're on it. And there are also alternatives to that if you wanted to. So you could do a milk and yogurt diet, for example, where you have 2 pints of milk, 2 diet yogurts, and a couple of pieces of fruit. The alternative to that, again, is meal replacement. So something like OptiFast or SlimFast, something like that, where you have about 800 calories worth of shakes per day. We don't particularly like you doing that one because you're going to be on liquids after the operation. So we prefer you to eat proper food. So it's better for your bowels. After the operation, you're going to be on the recovery diet. So it's liquids, puree and soft for 2 to 3 weeks on each stage, depending on which operation you have and your surgeon and how you're progressing really. So stage 1 on the fluids, taking sips initially, gradually increasing the volumes that you're having, and you're aiming for 2 litres a day. You need to be drinking very slowly and avoiding gulping, and avoid fizzy drinks and alcohol like we've already talked about. And there's an example of what you might have on a typical day there. So fortified milk, so that's milk with added milk powder or protein powder. Stunfast maybe for mid-morning or some kind of milky drink. Smooth soups, so any soup that's blended and strained would be okay. Going for the high protein options where you can, and smooth thin yogurts as well. They're all types of foods that are okay. So one thing that I would recommend when you're planning ahead and preparing yourself for surgery is making sure your kitchen is kind of up to scratch, and make sure you've got a blender, and make sure you've got a sieve handy as well, maybe some ice cubes, ice cube trays, so you can store things in there for the liquids and the pureed stage. So yeah, get your kitchen prepared too. You're going to need that blender for the next stage as well, because the next stage is the puree, where you're having kind of baby food, so really soft, sloppy stuff that could just kind of drop off a spoon. We want you to be eating regularly still, so making sure you've still got that regular pattern that's on the screen there in that example. Having a couple of tablespoons of puree at each meal, so that's where those ice cube trays come in really handy. So you can cook in bulk, like we mentioned before. So something like for example, a chili or something like that, blended down really well with a bit of mashed potato, something like that. If you made yourself one chili and blend it up really well, put that into ice cube trays, that one chili will last you a good 2 weeks pretty much, if you split it up and have it with other things. And then the next stage is your soft diet, and making sure that you're gradually introducing more and more texture over those next few weeks. So you start off with kind of almost lumpy puree, and then you introduce more and more texture until you're back to normal food, but obviously in very small portions. And it's really important that even from that pureed stage that you do take your time with your eating, and you follow that rule of 20, making sure you're taking small bites and chewing well, etc. And then back to normal really. Normal consistencies after kind of 9 to 12 weeks, I guess, and making sure that you're doing what we ask you to, eating regularly, having snacks in between, but only if needed, making sure you follow those eating habits, drink plenty in between, and yeah, listen to your body really. And again, there's an example meal plan that's up there. That's what we'd like you to be aiming for eventually. And just remembering those eating habits that Nikola went through before, that rule of 20, really, really important, and practice them early on. Can't really stress that enough. And even during your tier 3 service now, do try and practice and get into good habits of things like eating at the table, separating your eating and drinking, and stopping when you've had enough. And an important part of the eating habits as well. So we know there's a few behaviors that predict weight regain. So one of them is grazing, so nibbling between your meals. So if you're having your set meals, that's fine, and having a snack in between your meals is okay, but try not to graze and try not to nibble, because you're eating the same as you were before, but you're spreading it out over the day. So try and avoid that. The other thing is having soft food. And although we've put you on this recovery diet and it's all soft and sloppy and liquid, eventually we want you to be completely off that and going for solid textures that are going to keep you full from small portions. The other one is returning to food later on. So if you've got halfway through your meal and you think, well, I'll save that for 20 minutes and go back to it, that's something that we want you to avoid, because again, we would say that would be grazing. The other bit that I was going to share was for the micronutrient supplements, and we've already touched on that a little bit, and looking at multivitamins, iron, and calcium and vitamin D and B12. These are the ones that we put everybody on after surgery. The folic acid we only really put you on if you're wanting to conceive or if you're pregnant, but otherwise there's enough folic acid in your multivitamin and your mineral supplements. So we put you on one Forceval, which is a multivitamin, a couple of iron tablets, a couple of calcium and vitamin D, and obviously B12 injections every 3 months. All these are the things we will test for when you come for your blood tests, but we don't routinely put you on any additional. There's sufficient in your Forceval to meet the requirements for these 3. So that's it for my brief slides. And let me just look at my notes to see if there's anything that I was missing. Yeah, a couple of things to be prepared for. One of them is excess skin. So really, after surgery, do prepare that you're going to have some excess skin. There's not many people after surgery that lose that weight that don't have a little bit of excess skin there. So I'd rather you go into it thinking that you're going to have some than hope that you don't have any at all. So that's something to keep in the back of your mind. We do have psychologists on board, as do all the tier 3 services, and this is a life-changing operation. So utilize the psychological support. At tier 4 in the bariatric service, everybody is entitled to a psychological assessment and maybe some therapy if needed, and support afterwards. So please do utilize it, and think of it as an opportunity to share your kind of behaviors with food and how you want to change them afterwards. And the other thing to prepare for is follow-up. Make sure that you're prepared to come to follow up for 2 years. So you have regular input for 2 years after surgery with myself and Jodie, the nurse, and the rest of our team, every few months as needed after surgery, or more often if you're struggling. And then you do have annual review lifelong. So our consultants will look after you every year. They will bring you in for a blood test and make sure you're taking all the supplements that you should be, and adjust your prescription should things change in terms of national guidance. So do come for follow-up. Even if you think you're struggling or regaining weight or anything like that, please do come back to follow up, because we don't know if we don't know you're struggling, we can't help. And I think that covers everything that I've got on there from between myself and Nikola.
Amazing, thanks so much. Ladies, if you want to pop back in, and then we can kind of talk through some of these questions. So the first questions that's popped out to me is, when you're on the liver reduction diet, how should you go about exercise? Should you be exercising? Is it safe to? Will you have enough energy? That kind of thing.
Yeah, absolutely. Yeah, exercise is a key part to it. Making sure that you're exercising beforehand to make yourself fitter and keep going with that afterwards. You might have a little bit of an energy lull if you're on this liver reduction diet, certainly, but it's not a reason to stop you exercising. Maybe just don't do it with the same intensity, I would say.
Oh, Stevie, you're on mute.
Thank you for that. So somebody's just asked, can the liver reduction diet keep you going without feeling poorly? And I wonder if potentially this person means, could they do it for a longer period of time?
Yeah, so you potentially could do it for a little bit longer, but only do that if really we ask you to. Really, you shouldn't be on that much of a low-calorie diet for that long of a period of time without blood tests and monitoring. So you might end up getting cramps and headaches and feeling quite poorly with it eventually, quite run down. So it's not something to be really followed for the long term. It's just a short, sharp shock to get that liver as small as possible and get as much weight off the middle as possible in a short amount of time. So sometimes we ask people to follow it for 4 weeks, but that's the longest we've ever really asked anybody to follow it. Anything a little bit longer than that, and we'd be modifying it to give you a little bit more calories and a bit more energy. So yeah, just two weeks in most cases, please.
I suppose from our perspective as the tier 3 services, something we're looking for when we take you to that MDT is to see if you've made lifelong sustainable changes and you're eating in healthier ways. So if we saw that you were on a diet long term and you were having, just liquid, then that would be something that we would have to discuss with our MDT and might not be seen or wouldn't be seen as that long-term sustainable change. We know a diet stops working when the second you stop doing it, you regain weight again, and that's likely what would happen in that scenario if you were just having a liquid diet. I mean, Anina, you can probably give a lot more there as a dietitian, but
yeah, absolutely. I feel like people that we have had recently that we either given an extension to or had to say no to is people who have been through the program, and maybe even some of them have lost the 5%, but when we've looked at the quality of the diet, they haven't made the changes that we want to see. And it seems quite harsh to obviously say no, but what we want is obviously to be successful after the surgery with sustaining those changes and not getting the nasty side effects like dumping syndrome or the weight regain. So yes, when we are looking at the quality of your diet, there is a reason why we either give you an extension to make changes or, feel as an MDT that the surgery isn't the best choice for you at that point.
Stuart's actually here, who's one of the previous patients that's had surgery, and he's just popped to the chat that he ended up being on the liver reduction diet for 4 weeks due to a delay in surgery, and he said he was fine. But
yeah, absolutely. There's not going to be any initial kind of problems with it unless you're diabetic or that type of thing. So yeah, we do get the odd person that's like Stuart. Unfortunately, gets cancelled, pushed back for 2 weeks, so it feels like you're starving yourself for 2 weeks. But it's not something that we do very often.
I'm sure Stuart would say it was worth it in the long run. So lots of people are asking, do they actually get a copy of maybe a meal plan or a diet sheet, or are they given kind of what you've just shown, Chris, in terms of you can have X amount of portions of this and that, and they're free to go and make their own? I think lots of people seem like they want a bit of structure and maybe a bit more guidance. Is that something that's given?
Yeah, absolutely. So in our written information, we have both of those things. We have the tables of the different portion sizes, how many portions of each you can have, and then we put it into a meal plan, an example meal plan, and then you can use that to fit around yourself and change the portions, well, not change the portions, but change the types of foods to fit in with your pattern and your likes and dislikes. And then if you're still struggling with that, then we can have a one-to-one and go through it. So I always encourage people 2 weeks prior to the operation, as soon as they get a date for the surgery, go 2 weeks back, start having to think about it, and then make a plan. And if you're struggling with anything, just give us a call and we'll help you through it.
Somebody's asked, could they still be considered for surgery if they had celiac disease?
Yes, yeah, they can be. It might affect the type of operation that they have, but yes, it's not a definite no.
Perfect. It's probably I will post in the chat some of the surgeons' videos, and they might cover those topics in more detail on there. So I'll pop them in the chat in a little minute.
Absolutely, yeah, and things with like IBD as well. So it's not a no. It's just the type of surgery, and that comes with individual discussion with the surgeons. So yeah, definitely put those videos up there.
So probably one for us from the tier 3 service here. But how do we record the changes we have made, and do we need to prove what we've actually changed? Anina, do you want to go first?
Yeah. So do you mean in terms of when we review you to put you forward for bariatric surgery?
I think that's it, but I suppose to be able to go forward for a bariatric review, you would have to kind of have evidenced or made some significant changes, wouldn't you? So I think people are wondering, how do they actually record those for us to see?
Yes, so obviously we would want to see that you're monitoring. So at the moment, like things like food diaries, because you'd want to go through like a diet history or a typical day. So just to see, you know, maybe what you ate the day before, just to check that you are kind of taking on board the advice that's given throughout the programme. In terms of monitoring your weight throughout the programme, you will be asked at key points to monitor your weight. We do encourage you to do that weekly anyway. Not so we can kind of judge that, it's more for you to keep on track. So when you get to the bariatric review, it's not a nasty surprise to know what your weight is. We have started asking for a picture of your weight as well, just because we want it to be accurate for obviously to send on to the tier 4 as well. So in terms of monitoring, using the techniques you have during the program, so food diaries, or if you use an app to monitor your intake, all of that would, you know, help us in the review and also help you post getting discharged from the tier 3 and waiting for the tier 4.
I suppose we talked quite a bit about apps before, didn't we, in your presentation, Nicola? So there's things like MyFitnessPal or the Fitbit app where you can record your weights and your step count, for example, your sleep patterns, your eating habits. So they're quite good to look at all of your different kind of health behaviours in one place. Something that I recommend lots of my clients to do, especially if they don't feel they're losing weight quickly enough, is, or in their own mind, you know, for us, any weight loss is weight loss, and it's all a step in the right direction in the long term. But maybe to take measurements. We don't always see a change on the scales, do we? But we start to see changes in our body. So maybe taking a waist measurement or your arm or your thigh can keep you motivated on weeks where you don't kind of see those scale changes. So that's something that I often ask my clients to monitor. It would be like their waist circumference, for example. Nicola, anything to add there? I suppose
I was just going to... Can you hear me? I'm hoping I'm still here. I was going to add to that it's really important that actually you find the right monitoring method that suits you best as well. So it might be that, you know, applications are for you prefer the written, handwritten food diaries, things like that. Reflective journals can be really helpful as well, particularly if you tend to forget, you know, the achievements that you have had thus far. To have that log and be able to look back at all of your progress on this journey, it can be really, really helpful. As well, but absolutely really thinking about what suits you best. And what we do at More Life, and I'm sure the other services are the same, but we really do try and get you to create SMART goals at the end of each session. So it really is keeping that focus area, and we track it on our side as well. So do set goals with your practitioners at the end of each sessions, because that's also a key way that we do monitor the changes that you are making.
Thank you. So quite a few people have actually asked as well, if my weight, if I lose quite a bit of weight and my BMI drops below 35, would I still be eligible for bariatric surgery? Question a point like you.
Do you want me to say that one?
Yeah, please.
Yes, essentially. So it all goes on your starting BMI. So your BMI when you get referred into the tier 3 service. So nobody's going to punish you for dropping a huge amount of weight. We're not going to kick you off. We might question if you do drop to a significantly lower BMI. We might question if it's the right thing for you because you've already done the needful. But certainly we don't punish people for trying to lose weight. And from our experience in tier 3, it's not really very often that happens, to be fair.
Thank you. So somebody has asked, if they're really busy and they kind of work away quite a lot and they need to eat the soft foods, could they eat something like a baby food? Would that be appropriate, or is that not got the right nutrients in it?
So we always say the baby food's okay as a backup. So you can have it in your bag just in case, or if you're in a meeting or something like that. But who wants to see you eating baby food, really? So going for, if you're in that situation, maybe a soup might be the better option, or a meal replacement shake or a protein shake, something like that, might be the better option. So baby food, obviously made for people this big. So yeah, I'd rather you be cooking in bulk, making it yourself, and freezing portions, really. So it's not no, they're not allowed. you can have it as a backup, but I'd rather you be having the other things as a first option.
Perfect, thanks, Chris. So this question is actually from somebody who's had surgery, and I think must be still be coming for some support to kind of keep the information fresh in their mind. So, how do you stop feeling constantly sickly? I feel like I've had a constant seasickness since the op, and I also haven't lost weight, although I'm eating as advised and following the recommendations. So I suppose maybe take the sickness first.
Yeah, so the nausea can, a lot of people experience nausea in the first kind of few days, and it kind of settles afterwards. If it's an ongoing problem, then we need to look at the medications that you're taking. So some of them can affect your nausea. The main one being that big whopping multivitamin that we put you on, and the iron tablets, they can make you feel quite nauseous. So maybe stopping those for a couple of days might be an option, just to kind of see how things go. There's another couple of medications that might be causing it, so we could look into that. But also we can give you some anti-sickness tablets just until that dies down. And in terms of kind of approach to nutrition, if you're feeling nauseous, it's always better to have a little and often pattern, and quite often, making sure that you're not overdoing it. So your portion sizes are small and not too big, because that can cause nausea if you're having too much, or if you're overfacing yourself as well, that can cause nausea. So smaller and often, and looking at your medications, that type of thing is going to be important.
Thanks, Chris. Somebody else, Catherine, has said, I find it hard to get the time to prep meals and I work long hours. Is there anything that you could suggest to help her with that? And she also says she skips a lot of meals. How would that impact Catherine later down the line if she'd had surgery?
In terms of kind of your meal pattern, that is like where I would start kind of as the step one, is trying to implement a good meal pattern. So it's thinking really about your routine and your job, and thinking about the best you can do, even if you're, not getting 8, 12, 6 o'clock, thinking, okay, could I have a late breakfast and then a late lunch and fit something in later? And, sometimes we don't make time for ourselves in busy jobs, depends on what you work as. So it's important just to kind of make that time for yourself, and ask, if you're not getting a break, ask if you can have a break. You should be having it. It's important to really kind of implement that structure. In terms of having time to meal prep, great if you can. If not, you can still make nutritious meals that are quick to make. Things like stir fries, for example, can take a few minutes really to make. Just thinking about kind of easy to prepare recipes. It doesn't always have to take a lot of time. We wouldn't say going for like ready meals all the time, but if you really rush for time, you can read the labels on ready meals and go for kind of healthier options as well there, or things like soups as well. There's a lot of things that can be quick, don't take lots of time. So meal prepping isn't for everyone, but it is a good thing if you're someone who's maybe not has got much time later in the week to just take something out the freezer.
Thank you. And what about the skipping meals kind of post-surgery? How would that impact somebody, Chris?
So yeah, I think in the short term, you'll become quite malnourished. You won't have a lot of energy. You'll start to feel pretty rubbish. But in the long term, it can actually lead to weight gain, because if you're skipping meals, you might be a little bit more hungry later on. So you overeat a little bit and you stretch your pouch. You stretch your pouch, you can eat more, and then the cycle continues. Also, if people don't eat very much during the day, they tend to get into bad habits and graze and nibble later on. So that over restriction during the day often leads to overeating later on. So it's not only bad in the short term, but in the long term, it can cause problems. So that regular eating pattern that we've all talked about is important, and however you can do that the best, like Nina says, maybe cooking things in bulk if you can, but having some quick and easy meal ideas at the ready. One of those little pots of beans, absolutely fine. Put that in the microwave, and away you go. They don't have to be a 3-course gourmet meal, but as long as you're having something.
Perfect. So somebody else has asked, is it the same dietary needs if you have the sleeve or the bypass, or are there any differences?
Yeah, we like to keep it simple. Yeah, so everything's the same. Yeah. You're less with a sleeve. You're less likely to get dumping syndrome, although yes, it still can happen. You're less likely to get it, but we would still recommend low fat, low sugar anyway, for a sleeve. But yeah, the recovery diet is the same. The eating pattern is the same. So yeah, no real changes.
Thank you. So this is a question I've never seen before, which is unusual. Are hiccups a risk to surgery? I don't get them often, but I do feel them internally quite severely.
No, they're not a risk really. If we tend to get people hiccuping if they've overeaten or overdone it. They've had a bit too much to drink at the same time as the food. They might get hiccups, and some people actually hiccup when they're full. After surgery, I've also had people cry when they're full and sneeze, and a few other weird ones. So yeah, it's not a risk as such, the surgery. No.
So somebody feels full and then cries.
Yeah,
Is this post-surgery?
Yeah, like not crying, but tears, eyes watering. Yeah.
That's interesting. I wonder what the science is behind that.
Yeah, it's weird. People sneezing and all sorts. Yeah.
Okay, so this question's about Orlistat. So, if somebody was taking Orlistat when they went onto the liver reduction diet, would they need to stop taking Orlistat?
Not necessarily, no. They could still take the Orlistat on the liver reduction diet. If you're having it as low fat as you should be, it might not be as hugely as effective as it might have been before, but there's no reason to stop it. But then, for 2 weeks, it's up to you whether you do or not, but you would be stopping it after surgery.
Perfect. Right, I'm just going to pop down to the bottom of the questions.
Surprised there's not been questions about when can I have my surgery.
There's many of them, but I'm fielding them.
Okay.
Yeah, I mean, since you brought it up, I will ask everyone. It's normally my last question. But yeah, so people are asking from referral from us, from the T3 provider, how long are they likely to be waiting to be seen by Salford in this case? And Milo, I'll update you about Castle Hill a different time.
Yeah, so in clinic last week, we were seeing people that were referred between kind of 10 and 12 months ago. So that's what we're working on at the minute. Obviously, there's a big backlog, but we are getting through them and putting on extra clinics. And the good news is that we're doing many more surgeries now. So we're getting theatre lists regularly at Salford and in the private sector. So the people that we have got waiting for surgery are moving through. So things are starting to move. So it is positive, although we can't say, you'll have your operation within a year or whatever, which we'd love to do. Things are moving, so it's really positive.
Brilliant. That's great to hear. I will ask as well, there's been a lot of questions or comments on the Facebook group that kind of runs along with this group, and people are asking, they've been referred X amount of time ago and it's longer than they expected, I think from maybe the last time Jodie updated on timescales. Should they be ringing the hospital to know if they're on the list? Because we know as tier 3 providers, once we've referred them, we don't really know where they are on that list, and we don't
absolutely
always get receipt of that.
It's worth a phone call, because we have had a few instances where somebody's waiting, they don't know, and we've looked into it, and the referral's been intercepted or gone into the wrong department or something like that. So I would say the average wait at the minute is, like I said, 10 to 12 months for an appointment with the surgeon, and that's really before you hear anything. If you do want to check whether you are, if the referral has been accepted, you can give us a call and we can have a look on our tracker and make sure you're on it, just for your peace of mind. But that's not going to speed anything up for you. Jackie won't be happy with me.
Yeah, and I suppose if for any, no, I can't imagine she will be happy with you, Chris. I think my internet's a bit unstable, sorry. But what I was going to say is, if you aren't on that list, you won't be penalised for that. You'll be put on the list in the order that you should have been put on originally.
That's right.
We as tier 3 providers have the evidence to say when we've sent that referral. So, you know, don't worry too much about that at this point. There's quite an interesting question here about post-surgery. So what support is there for people who've gained weight after bariatric surgery? Because it's not unheard of, is it? And I think in our tier 3 services, we have got people that have previously had bariatric surgery and have had some weight regain. So this particular person said they had their op in 2010 and they've gained 2 stone and they lost 7 in total after surgery. But kind of any advice there, Chris, at all?
Well, yeah, I guess it's going back to the to what Nikola was saying before about making sure that you've got that support network built in, so you're not going to be gaining any more. So kind of making sure that you're monitoring yourself and weighing yourself and keeping yourself accountable to somebody. But in terms of follow-up and ongoing support, you do have that yearly follow-up with our medical consultants, and they can refer you back into dietetics. I'm not sure in terms of the other tier 3 services if you take referrals for weight regain after surgery. Last time I don't think you were. I'm not sure, but certainly from the follow-up perspective, we can see you afterwards a few years down the line. I'm not sure what your take on that is, Anina. Do you accept referrals for weight gain after surgery?
We do after a certain amount of time.
Yes.
I can't remember the exact time off the top of my head, but we would. But obviously that you need to kind of get yourself stable first after the surgery, and then we would look at considering you taking you back into the program.
Absolutely. So anything in that first 2 years, that should be with our team, with us, and getting you, like you said, getting yourself stable and getting you into the right habits, and hopefully in a position where you keep it off in the long term. But yeah, if there's local services, then use them.
Yeah, I think for us, we historically haven't taken anybody that's any less than 2 years post surgery. But what we do tend to see is people that have had bands privately, maybe 10 years ago, that are finding they're not working for them, and they've not been working for quite some time, and have now decided that it's the time to try and manage their weight again. That's what we tend to see. Just touching on gastric bands, somebody has asked, is a gastric band still something that's on offer within the NHS? And if not, why not?
So yes, technically, they will still put a gastric band in. However, it's not a favoured option or an operation that's in favour with our surgeons or in fact nationally. The most popular at the moment, I think, is a sleeve gastrectomy rather than a gastric bypass. And the reason why they don't like bands as much at the moment is because there's a few reasons. The weight loss isn't really as good, and it takes a little bit longer. It takes a little bit more fiddling with, if you like. So we've got to adjust the band with a needle in clinic and saline and things like that. So it takes a lot of coming and going to the clinic, which is it's fine. We can do that. But when the surgeons and the kind of medical community are seeing better results with something like a sleeve that doesn't need to come back to clinic but only just for blood tests, that's why they favour those procedures. I guess in the NHS, we take out far more bands than we put in. So patients that have had them done privately, they slip or they're causing problems, they've got an eroded port or, an infected port or, something like that, the band needs to come out and we take them out. And then those patients sometimes end up going on to have other operations.
Thank you. So one last question before we call it a day. So somebody's asked about hair loss. Is there anything they can do from a nutrition point of view to support their hair to grow healthily?
Yeah, absolutely. And hair loss, it happens in about maybe 1 in 10, 1 in 15 patients. So it is something, again, to be prepared for. And the main thing is really that you're taking your supplement regime. So you're taking the multivitamins, the iron, you're doing all the dietary things that we ask, like focusing on protein, etc., and making sure you have a healthy, balanced diet, including some, healthy fats in there, some nuts and fish and things like that, just to promote that overall growth. the majority of the cases, the hair loss tends to be due to a stress response. So you're losing that weight really quickly, and your hair starts to fall out. So you don't end up looking like me. It might just kind of come out on your brush a little bit more, or you'll notice it more coming out in the bath plug, or in the shower. It can be quite distressing for a lot of people, but just be reassured that it will grow back when you start to plateau. When your weight loss starts to plateau, we tend to find the hair grows back. We used to put people on extra zinc and selenium supplements and things like that, but we found that actually didn't really make much difference. So we would only put you on those supplements if you had a confirmed deficiency via a blood test. We wouldn't just put you on them as kind of a just in case, because one, they're expensive, and two, they taste awful. So yeah, we don't want to put people on those.
Thanks for that, Chris. Right, well, I think that's about as much time as we've got questions. That I can't speak now. That's how much time we've got for today. Thanks so much, everybody, for your questions, and thanks to Nikola for speaking and Chris for speaking. That's really informative. Can I just ask that everybody please fills in the survey before they leave, just so we can keep the sessions going, and we can, make sure we provide the sessions that you are looking for. So I'll just pop that in the chat one more time, and then you're free to leave. But thanks again so much to our panel and speakers. You've been fantastic, and we'll see you next month on the first Wednesday of May. It'll be, won't it? It's gone very quickly. So lovely to see you all, guys, and thanks again.
Thank you, Stevie.
Thank you.